Welcome to Startup Health TV. I'm Logan Plaster. My guest on today's show is Olivia Zollinger, the CEO of a nonprofit called Swiss Healthcare Startups. As the name suggests, Zollinger and her team support startups that bring value to the Swiss healthcare system. But it's not all about what's happening in Zurich. After all, with their history and culture of research and education, with the proximity of pharmaceutical companies like Novartis and Abbott, startups that are incubated in Switzerland really are well positioned to scale up in Europe and beyond. In our conversation, Olivia explains what's unique about the Swiss startup scene. I learn a bit about the German idea of Schpeticks, and we hear about 3 winners from their recent startup competition who are now all heading to South Korea as a part of the program. It's a great conversation. Hope you enjoy.
Crazy.
All right, Olivia Zollinger, CEO of Swiss Healthcare Startups. Thank you so much for joining me today for this episode of Startup Health TV.
Thanks for having me, Logan.
You run a nonprofit that supports startups that, quote, aim to add value to the Swiss healthcare ecosystem. I really wanted to talk to you today just about that ecosystem. So maybe just start by describing what is the startup landscape like in Switzerland?
What is the startup landscape like in Switzerland? Well, you're sitting in the US, so probably compared to your perspective, small, but still extremely productive and important. I don't know if I can share a screen here.
Sure,
that
go
is
for
appropriate. Yeah, there's something I can show you. Maybe while I'm setting that up.
Who are the big players in terms of like incubators and accelerators?
You asking me a question. I can tell you that there are many incubators and accelerators around in Switzerland. We're not one of them. Maybe just a few more details on what we do. We provide startups with opportunities for exposure, and we help them find the partners they need at the stage that they're in any given moment. I can name you some of the incubators and accelerators. Sure. There's Day One out there. We have Blue Lion that is also based in Zurich that supports early stages. There really is a big number. I think the way that we differentiate from other organizations is that we're really trying to bundle all startups and have them come together to make sure that we can, with that, help them, what I just mentioned, access to relevant partners in the ecosystem in Switzerland.
How do you do that? You said bundle them together. What do you mean?
Well, what we do is over the last 12 to 18 months, we've built a database where all the startups that are interested in being members of our association build a profile. And you can imagine with a number of startups coming together and interest increases of the rest of the ecosystem to find them in a more easy way than it was possible before. So I think I'm jumping around a little bit, just real quick. Based on our estimates, we have approximately 1,000 startups. So back to your original question, How is the startup ecosystem looking like in Switzerland? There are approximately 1,000 startups based on our estimates or estimations that are active at any given moment in time in the area of health. Wow. Currently, we have about 435 startups that are part of our nonprofit organization that are members. And that, coming back to your last question, they all unite in a database. So one of the activities that we do that allows them to connect with each other. So there's peer-to-peer connection possibilities, but also very importantly, interested players from the ecosystem. That includes anyone from insurers to pharma companies, medtech, investors, healthcare providers, service providers, you name them. They get the opportunity to find the startups that they're interested in partnering with.
Has your organization identified themes in those 1,000, that's a lot, 1,000 healthcare startups in your ecosystem? Some themes that have emerged over the last years, the kind of companies, the kind of clusters?
We have identified themes. The data that we see also shows us that there is high activity in the area of medtech, which is what you see here. This is just as a quick disclosure based on 376 startup members as of January, but probably hasn't changed that much over the course of the last few months. And you can see there is a really big number of startups being active in the field of medtech. Many as well in digital health, e-health, but as you can see below here, we have an entire organization focusing on startups in insurance tech, where we see a lot of activity. Femtech is a very important field as well, despite the numbers being small here. Many startups are active and trying to develop solutions for the elderly in the context of age tech. Of course, many activities still going on in the field of telemedicine, where there still is a lot of work to be done, just to name a few of these clusters that we see.
Talk to me about kind of the cultural landscape for innovation in Switzerland. You know, Switzerland is a leader in education and research and technology, but it's known for being a considered, thoughtful culture. And sometimes innovation and startups require a certain amount of risk and sort of rule breaking. And so obviously these things can exist together, but just maybe you could speak to how that fits into the Swiss culture.
It's an interesting question. During my time in the US, I learned not to generalize, Logan. So you're putting me on the spot here. I agree with the summary you just made. Swiss people may be a little bit more reserved, a little bit more risk averse, but quite honestly, since I've come back to Switzerland 1.5, 2 years ago, I haven't really seen that happening so much in my environment. So I can't confirm the mentality that maybe people from the outside of Switzerland observe from Swiss people is actually true in the area of innovation and of startups in the healthcare sector.
I know you studied in Philadelphia and lived in the United States in New York. I'm wondering how that experience kind of informed what you're doing now, kind of having that global perspective on healthcare, perhaps on accelerators, et cetera.
Well, during my time in the US, where I first did an MBA and learned a lot about business and many other things, maybe just in brackets, for me, an MBA really is about learning about oneself as well, and a form of professional development rather than content knowledge that is gained. At least that's my experience there. And also during my time at Celgene, I learned a lot about the corporate world, which has given me a great foundation for the work that I'm doing right now. I've been born and raised into a family of entrepreneurs, so I think I kind of have it in my DNA to be closer to the entrepreneurial area. Smaller, of course, you can make a bigger impact in a smaller environment, typically, than in the corporate environment. But for me, it's a great environment to be in. I'm very excited about the entrepreneurs I see, young, old, with a lot of experience, with lesser experience. I just love the people that thrive on what they're doing and their vision and the difference they want to make in their world. Back to your question, what have I learned in the US? Well, other than the exposure that I got, definitely things all around culture and soft skills.
Yeah. I have to ask, what's your family connection to entrepreneurship? I ask just because so often in this field, there is a personal connection, and there's a reason why someone is drawn into what can be a higher risk situation. You know, you might be giving up as a startup founder. You might be giving up a safe salary to try to change the world. You know, it's a big deal. So, kind of, what's your personal connection?
Well, it's actually not as exciting as it might be. It's my father who was born into a family of in the gastro environment. His parents, my grandparents, they were running a restaurant. There were 5 kids, not a lot of money around. and my father emerged from that as an entrepreneur in the area of real estate, first as an architect and then in the area of management and mostly development. So I guess I've just seen how really wanting something and having a clear vision and drive can get you somewhere. For me personally, I think my main driver has really been that interest in helping make a contribution to the area of health. I've always been intrigued to the area of health, and I'm not a scientist. Maybe I'd like to be one in my next life, but not being a scientist, I think approaching it from an entrepreneurial business perspective is another way of making a contribution to furthering innovation in that space.
I understand. That's very in line with kind of our ethos here at Startup Health, and I can see how that would be very fulfilling. I know that the mission at Swiss Healthcare Startups is to promote startups that are, seeking to benefit Switzerland, but so often healthcare startups have either regional or global ambitions. So talk to me about how you set companies up for that. Let's say they want to expand to the EU. Let's say they want to expand to the United States. I know the US is a very exciting market for a lot of startups because it's so big. Kind of how does that work, that you support them locally, but then also do you support their global ambitions?
Yeah. Well, we basically do three different things. We organize events. We have different formats, digital, in-person events for smaller audiences, bigger audiences. Some of them are open, some of them are closed for our members. But they all have the same goal, which is to provide the startups with an opportunity to present themselves in front of the Swiss ecosystem. As you might imagine, in these environments, connections are made that also may have a relevance eventually to other places than Switzerland. This is maybe more of an indirect impact. The second activity we have is the database that I mentioned before, where startups can interact with each other and with members from the entire ecosystem. I guess the third activity that is the most important one when looking outside of the borders of our small country is the booster program. In the context of the booster program, we enable, last year it was 1 startup, this year it's 3 startups to join a boot camp that preps them for market entry. Last year there was Nicola with Neurosoft actually was planning to go to the Silicon Valley, but then ended up joining a virtual version of the bootcamp due to COVID. This year, we actually just announced our 3 winners yesterday. We have 3 organizations, 3 startups that will go to South Korea in October for market entry there. So these are some of the things that we do for the startups to bring the value that they create in Switzerland to the rest of the world.
Do you have a sense, let's talk about funding for a second. Do you have a sense of whether the majority of funding is early stage versus later stage, just given the maturity of, I guess another way of asking about the maturity of the startups in Switzerland?
Well, to the first part of your question, Switzerland is one of the most innovative countries, right? If you look at the ratings, and it's also very effective in transforming innovation investments into results. Having said that, and also with early stage investments having increased quite a bit over the last few years, the Swiss innovation scene is still underfunded. And that is because almost half of investments in Swiss innovation or in Switzerland comes from outside the country. So from a Swiss perspective, there might also be an interest for the Swiss market to get more active when it comes to funding, particularly early stage ventures.
Do you have a sense of why that is?
Well, it might tie back to the mentality question that you asked before.
Yeah, just a risk aversion. Obviously, Switzerland is known for incubating great pharma advancements, and so I would imagine it would be an environment where theoretically you could create some amazing collaborations between maybe pharma startups and a big startup, or a software startup that helps the pharmaceutical industry. Do you see much in that way, in terms of like making the most of those pharmaceutical company connections?
I can't really confirm nor deny that, Logan.
I wonder, you got to take advantage as a startup. You got to take advantage of the companies that are within your region. Just yesterday, we had an event with, the head of a regional insurance payer, and the really discussion was around sort of understanding your local connections versus, like we were just saying, going global instantly, trying to think about, okay, the EU, United States, like who's in my backyard is an important question when you think about a local accelerator. Are there startups that are real standouts to you that you're really excited about, that kind of are emblematic of the Swiss healthcare scene, carrying the torch?
Whew. It's a difficult question with all the startups.
They're all your favorite, I'm sure.
Yeah, I mean, what I'd like to, or what maybe is a good occasion here to mention, are the three winners of our program. I mean, they really went through a rigorous process, starting with a group of 9 experts, national and international experts, looking at their ventures, selecting like a top 7, I think we had, then going through public voting with a few hundred votes, which led to a top 5, and then us together with the Science and Technology Office of South Korea, Seoul, we chose the 3 winners, and they're up to something big. There's Clever Care. Clever Care is a digital Schpeticks helper. Schpeticks maybe has to be explained in a global context.
Yeah, sure.
Schpeticks is derived from the German Spital extern, and refers to healthcare help and support provided from outside hospitals or nursing homes. So people actually going home to the elderly, home care.
Okay.
And what Clever Care is doing is they digitize that service, which has a great potential. Another startup is Limula. Limula enables personalized cancer treatments. I'm sure you have been in direct touch with personalized treatments that are being developed. One of the big problems there is that they're so difficult to make that they end up being too expensive. You mentioned cost before as one of the clusters or the moonshot verticals that you're looking into. So they're affording these treatments and enabling access for the patients is a very important topic that they're approaching. They're building a platform technology for the CGT manufacturing, which allows a rapid and safe production of the same. And then the third one is Way, in a complete different context. And Way is a human motion analysis for fitness and health. They basically digitize human movements through human motion analysis to make the products more competitive, immersive, and intelligent. Cool group of people, all with high-level drive, and they're going to South Korea in October, hopefully making a difference to patients, not only in Switzerland, but also around the globe.
All 3 are going to South Korea, or Way?
All of them.
All 3, okay. And that's through a partnership with what organization in South Korea?
We're partnering with the Science and Technology Office, which is part of the Swiss Next Network in South Korea. Very
cool. Very cool. Well, that's actually a perfect note to end on, because that's the kind of information that we need at Startup Health to understand how we can improve our global collaborations, because our mission is to promote these 12 big health moonshots, everything from improving access to improving children's health, brain health, fighting the opioid epidemic. And we want to do that through a global collaboration of entrepreneurs and startups. We've got 350 companies in the portfolio from 26 countries, but I don't believe we have any from Switzerland. And so it's important that we have these conversations, understand what's happening. I mean, you just mentioned a type of home care that was a word that I'm totally not familiar with. So there's communication that needs to go on, and sort of a translation